Welcome. In this video, you will be informed about the course material of the HealthMi project in summary. Module 1. National Health Issues. Introduction. The Migratory Phenomenon. Migration significantly affects individuals and countries, with the potential to enhance inclusive and sustainable development through well-implemented policies. The connection between migration and development is recognized in global frameworks like the 2030 Agenda for Sustainable Development and the Global Compact for Migration. As of 2019, nearly 272 million international migrants existed, making up 3.5% of the global population. Main public health problems in EU member countries. Behavioral and environmental risk factors are primary contributors to mortality rates across the European Union. Common health concerns include non-communicable diseases, NCDs, mental health issues, and substance abuse, exacerbated by social determinants of health. Key public health issues in migrants. Migrants often experience increased vulnerabilities due to factors such as poor living conditions, limited access to healthcare services, and higher susceptibility to infectious diseases like HIV and tuberculosis. The health of migrants is influenced by the conditions of their country of origin, transit, and destination, as well as the policies in place at these stages. Impact of health policies on health inequalities in migrants. The European Centre for Disease Prevention and Control aims to reduce health inequalities, focusing on vulnerable populations like migrants and the Roma. Barriers faced by migrants include language differences, cultural misunderstandings, stigma, and restricted access to health information, all of which can negatively affect their health outcomes. Module 2. Epidemiological Picture of Migrants in the National Country. Introduction. The module provides foundational knowledge essential for healthcare professionals working with migrant populations. This includes understanding the unique clinical and epidemiological challenges in migrants' health. Migration can impact physical and mental well-being, increasing vulnerability to health issues. Health outcomes are influenced by various social determinants and change over time. Health is a basic human right and essential for sustainable development. Migration phases. Migration involves different stages: pre-departure, travel, transit, destination, integration, and return. Each stage affects migrant health differently, requiring targeted health interventions. Historical context. Europe has shifted from a region of emigration to one of immigration, with significant public health implications. Migrants often have higher seropositivity for infectious diseases than host populations, but accurate prevalence figures are challenging to determine. Screening for communicable diseases. It is important to consider screening migrants for communicable diseases due to the varied health risks and backgrounds they bring. Module 3. Enforcing Intercultural Competences and Sensitivity of Diversity. Introduction. With over 90 million international migrants in Europe, health systems face significant challenges that require effective response capabilities and multi-sectoral coordination. Need for competent care. Health services must be interculturally competent and sensitive to meet the diverse needs of migrants effectively. Community participation. Engaging communities in health service design ensures accessibility and inclusivity, fostering trust and empowerment. Networking with migrant support groups enhances capacity and sustainability. Intercultural competence and diversity. Sensitivity. Cultural competence involves integrating culturally specific norms into healthcare, while diversity sensitivity requires awareness of various cultural differences. Patient-centered care should guide clinical decisions based on individual preferences and needs. Health sector responses. Standardized intercultural competence training is lacking in Europe but essential for all healthcare levels. Key questions for policymakers and practitioners. Consider actions at systemic, organizational, professional, and individual levels to implement intercultural competence and diversity-sensitive practices effectively. Module 4. Medical, Social, and Psychological Area of Migrants. Introduction. Focuses on the complexities of healthcare for immigrants, including refugees, asylees, and special immigrant visa holders. Highlights the importance of a structured, interprofessional approach to address diverse healthcare needs. Emphasizes the need for population-specific assessments and community health needs assessments to identify care gaps and integrate community partners effectively. Key topics covered. Theories and models of migration health. Discusses various models and theories pertinent to the health of migrating populations, considering both international and national contexts. Cultural dimensions of health. Examines how cultural factors influence health perceptions and behaviors among migrants. Mental health and psychopathology. Addresses the impact of migration on mental health, providing basic knowledge in psychopathology and treatment challenges. Highlights the significance of mental health literacy and the use of tools like the DSM-5 cultural formulation interview for better patient outcomes. Sociocultural and psychological adjustment. Explores the socio-cultural adjustments migrants must undergo and the psychological impacts of migration. Ethical and legal issues. Discusses the ethical dilemmas faced by healthcare workers in treating undocumented migrants. Stresses the importance of ethical training and guidance for handling these complex situations. A robust model of care for migrants involves an interprofessional team and ongoing community partnerships. Continuous evaluation and adaptation of care models are necessary to meet the evolving needs of migrant populations. Module 5. Stress identification of migrants. Introduction. Understanding migrant stress. Migrants often face unique stressors due to their experiences, including displacement, cultural adaptation, and uncertainty about their future. Types of stress. Pre-migration stress includes trauma from conflict, persecution, or economic hardship before migration. Post-migration stress involves challenges like adapting to a new culture, potential discrimination, and navigating complex immigration processes. Impact on health, physical and mental health. Stress can manifest in both physical and mental health issues, requiring sensitive and informed approaches in healthcare. Barriers to accessing care. Migrants may face obstacles in accessing healthcare, such as language barriers, lack of understanding of the health system, or mistrust. Strategies for identification. Screening and assessment. Health professionals should be equipped to identify stress in migrants through effective screening and culturally sensitive assessments. Intervention and support. Providing appropriate interventions and support systems is crucial to addressing the stressors migrants face. Module 6. Better inclusion, well-being, and mental health. Introduction. Inclusion and mental health. Effective inclusion of migrants in society is closely linked to their mental health and overall well-being. Barriers to inclusion. Migrants often face barriers such as language differences, discrimination, and social exclusion, which can negatively impact their mental health. Promoting inclusion. Community engagement. Actively involving migrants in community activities and decision-making processes enhances their sense of belonging and supports their mental health. Cultural awareness. Promoting cultural awareness among health professionals and the wider community helps reduce discrimination and fosters an inclusive environment. Well-being strategies. Holistic approaches. Addressing the physical, mental, and social well-being of migrants through integrated services that consider the whole person. Access to services. Ensuring that migrants have access to mental health services that are culturally sensitive and appropriate for their needs. Mental health support. Tailored interventions. Providing mental health support that is tailored to the specific experiences and needs of migrants, recognizing the unique challenges they face. Collaboration. Working with community organizations and mental health professionals to create support networks that are accessible and effective for migrants. Module 7. Communicable diseases, hygiene and safety. Introduction. The Global Compact for Migration aims to facilitate safe, orderly, and regular migration while addressing unsafe and irregular migration. Determinants in migrant population. Migrants often come from low-income, unstable countries, leading to unsafe and irregular migration. Integration and inclusion are key for migrants to thrive in new societies. Key health determinants and safety protocols. Migrants face several health challenges, including lower access to health care, lack of health insurance, and language barriers. Public health threats are often linked to international population mobility, requiring global management and early detection. Preventive safety and hygiene measures. Emphasizes proper hand hygiene, use of personal protective equipment, PPE, and respiratory hygiene. Institutions should promote a safe climate, ensuring adequate supplies and education for staff, patients, and visitors. Module 8. COVID-19 and Consequences for Migrants. Introduction. The COVID-19 pandemic has severely impacted immigrants, affecting their health, employment, and education. Impact on migrants' health. Immigrants are more susceptible to COVID-19 due to socioeconomic disadvantages, poor housing conditions, and higher use of public transportation. They are often employed in essential occupations with higher exposure risks. Labor market integration. Immigrants are overrepresented in temporary, cyclical jobs in sectors hard hit by the pandemic, such as hospitality. Permit conditions and lack of networks further hinder their job prospects. Education of immigrant children. Online learning poses challenges for children of immigrants due to limited access to digital tools and quiet study spaces. These children often come from disadvantaged backgrounds, impacting their educational outcomes. Policy actions and recovery initiatives. Recommendations include monitoring immigrant health and education, ensuring access to COVID-19 testing and treatment, addressing housing and employment conditions, and supporting economic and educational measures for immigrants. Module 9. Public Service Interpreting Standard, PSI. Introduction. Community interpreters facilitate communication between public services and people not fluent in the local language, ensuring equality in service provision. Ethical and professional principles. Interpreters must be impartial, maintain confidentiality, and avoid personal opinions. They should keep up to date with relevant terminology. Interpreting skills and practices. Effective cross-cultural communication requires sensitivity to cultural differences and an understanding of various communication barriers. Interpreters often take on roles such as language communication facilitators, situational clarifiers, and cultural clarifiers. Healthcare interpreting. Interpreters in healthcare settings must navigate linguistic and cultural barriers, ensuring effective communication for patient care. Issues include reliance on unqualified interpreters, cultural differences in seeking medical help, and the emotional challenges of interpreting in sensitive situations. Coping with emotionally challenging situations. Interpreters may face stress and trauma, especially when dealing with victims of violence. Preparation, professional detachment, and clear communication of impartiality and confidentiality are crucial. Thank you for watching. The HealthMi project is co-funded by the European Union. Views and opinions expressed are, however, those of the authors only, and do not necessarily reflect those of the European Union or the European Education and Culture Executive Agency. Neither the European Union nor the European Education and Culture Executive Agency can be held responsible for them.